Hi, I'm Iris Feinberg, and our topic today is health literacy. Health literacy is the ability of people to access, understand, and use health information. Adults with low health literacy have low reading, numeracy, and digital skills, and often don't have knowledge about how their bodies work, how to access the healthcare system, and why preventive and chronic care self-management is important. Over a third of Americans have low health literacy. Having low health literacy matters because people with low health literacy are unable to read medication and discharge instructions, follow instructions on a prescription bottle, use a table or chart to calculate their insurance deductibles, find accurate health information on the internet, or understand the concept of risk. They're less likely to know about preventive health measures, to manage sick behaviors, to seek health information, and they're more likely to miscommunicate with their health providers. Only 12% of Americans have proficient health literacy. Lower rates of health literacy can affect people regardless of age, race, socioeconomic status, or education. Research tells us that there is a direct association between lower health literacy and poor health outcomes. But health literacy isn't just individual and one-sided. People who provide health information must also make sure that what they provide, things like insurance information, diagnosis and treatment plans, information about preventive measures like flu shots, are accessible, understandable, and usable. Health providers use a lot of jargon and often speak or write in a very direct communication style. It may be hard to understand what the health provider is saying, or what the insurance document says, or what that prescription label is trying to tell you. Communication is a two-way street, and both speaker and listener need to be at the same level for everyone to understand. And then there's also the issue of context. Anyone can have low health literacy depending on the situation. If you're sitting half naked in an exam room, even if you have 3 advanced degrees, you may be anxious, unsure of what your diagnosis is, and maybe also a little afraid to tell the health provider that you don't understand what he or she just said. And finally, health literacy doesn't exist in a vacuum. Individual factors and the socioecological context act together to explain individual health literacy levels. There are individual factors like genetics, biology, language, educational attainment, socioeconomic status, beliefs and values and attitudes, and the experiences that affect how people accumulate and use health information throughout their lives. Interpersonal factors focus on relationships with close others, and that includes family, partners, close friends, and culture, which all have a direct and indirect bearing on how people view health information and practice health behaviors. Community factors include education, employment, healthcare services, and neighborhoods. For example, adults who are employed are more likely to afford insurance and medical care and interact more with the health system. Formal and informal education help increase the acquisition, understanding, and use of health literacy skills. Neighborhoods can also have a big impact on how people can practice their healthcare skills. Is it safe to walk around the block like your doctor said to do? Is there a minute clinic when you have a sore throat and just need to make sure you don't have strep? Is transportation available? And finally, societal factors also play a role in developing health literacy. These include laws, the healthcare system itself, and entrenched disparities.